challenges if you're going to use probiotic as part of your clinical practice. Number one, there are many. If you go to the pharmacy, you will confuse by the colors, by the price, by the preparation, by the storage. More importantly, is there any clinical utility? Because you do not want to spend money for nothing, because your patient wants to spend money for diabetes, dyslipidemia, so and so. So you have to value the prescription you're going to give. The differences in quality is many, whether these probiotics are manufactured in the standard laboratory for the use in daily practice. Conflicting claims, these are the testimonials. Testimonial, we don't actually buy this testimonial. We have to do the medical statistical evaluation. The number of the need to treat, for example. If not, then aspirin will not be used in clinical practice to prevent ischemic stroke, for example, because they are so useful. The number to treat is so few, that's why we use in clinical practice. Different regulations, some country by country different. Some countries you can prescribe the probiotics, some countries you don't need to, you just go to the pharmacy, you can get over the counter. So it's up to you how to advise. So these are very important challenges of prescribing probiotics. So if you Google, I tried to Google a couple of days ago, just probiotics alone in Malaysia, you can see plenty of them. And I can't believe the probiotic for women, and probiotic for men, probiotic for children. My goodness, you know, how science can change this Chef Google or whatever that you want to use. So there are many of them, whether the capsule, whether the sachet, whether the fluid, it's just so many. And believe it or not, for the last nearly 5 decades or so, there are about 260 probiotics available. How are you going to prescribe? And you all know now, you prescribe very commonly anti-diabetic medication. In the past, maybe you're dealing with metformin, dimicron, but now it's about 26 or 27 oral hypoglycemic agent that you really need to know. Whether to protect the kidneys, to protect the heart, protect the lung or liver, whatever. I mean, you really have to use precision medicine. So there are many that which one that you're going to organize to choose the right probiotics. So, number one, you need to find the right strain. There are strain, species, or the genus of the probiotics. Number two, the quality of preparation of the probiotic. Not simply a normal set of laboratory, but has to be undergo a good manufacturing services. The allergen, and of course, you all know the National Health Mobility Surveys, how many Malaysians have diabetes. I can count in this room, many of here us having diabetes. So you can imagine how much sugar that in the probiotic has to be very considered, whether probiotic as in food or supplement, and how this shelf stability of packaging. If you buy, for example, Vitagen that we all buy for children, one Vitagen, small bottle, 1 billion liter bacillus, and in the fridge. So by the time you queue at the counter, you put in the cardboard, all the lactobacillus died already. So you basically bring drink to your children. Do you understand? So by right, you have to bring the appropriate containers to preserve the live microorganism, so that by the time you give to your children, they are still live microorganisms. If not, then you better give tap water or something like that. Clinical evidence, this is very important. You all know from the medical school, the randomized clinical trial, the meta-analysis are the best evidence for you guys to choose what treatment, why you use Lipitor instead of atorvastatin instead of simvastatin, why you use aspirin instead of clopidogrel, why you use ACE inhibitors, not ARB, for example, and why you use beta blockers. So there must be evidence-based practice. And of course, our community, our patient, rely heavily on, in fact, rely completely on us, how we prescribe. So it's a very important integrity of practicing medicine to our patient is very, very important. Link disease pathogenesis to mechanism of action. We have to have a molecular or microorganism signature in order to treat disease A and B, not simply just giving this probiotic, presumably because a good testimonial is not right. Does it follow regulation, whether, any specific regulation in particular countries, and what are the strain and disease specific? For example, lactobacillus is specific molecular signature to treat for disease A, for example, or bifidobacterium signature for disease B. So we have to know about, and of course, balanced efficacy and safety. Safety is paramount to our patient. Safety in terms of we don't want to compromise any even minor adverse event of our patient prescribing any medication, and of course choose quality product. So the first one, if I want to give you an example, the strain, what it means, Lactobacillus is the genus, Acidophilus is the species, and BCMC 12330 is the strain. This is commonly used for the Lactobacillus and bifidobacterium worldwide. It's commonly used in a lot of clinical practices. So if you look at the second point, whether you want to use a single or multiple strain, well, many studies show that it may be more effective multiple strain rather than single, but not all. But again, you need to increase the diversity of the gut microbiota. As I mentioned you earlier on, we lost over the time. So the quality over quantity, the CFU or colony forming unit is like your dose as you like whether you use 75 milligram of aspirin or 150 milligram. So in probiotics we call the CFU to measure the strength of it. Probiotics range, the higher the dose, it doesn't mean the more they're expensive, it doesn't mean the better to control the diseases, it doesn't mean more disease specific, it's just to show the strength of the diseases. So if you look at in Japan, for example, the billion, they are 50 to 100 billion, but essentially the less the billion, the less the microorganism contained in that probiotic. When I said earlier, the more the better, it was always right, but you must consider the quality of anti-probiotic. For example, some probiotic microorganisms, the moment you swallow, acidity in the stomach about 1 to 2 pH, they all be killed, so there's no point to take it. Because the manufacturers do not design their probiotic to counteract or to bypass the stomach or acidic environment in the proximal of the small bowel, so they can reach this portion of the small bowel. And this is very important because if you don't know this thing, you swallow the capsule of probiotics, all be denatured in the stomach. It's like you're taking the tap water or teh tarik drink or whatever you like, So it's very important because we want to make sure that these active ingredient or live microorganism arrive safely at the targeted area or whatever in the intestine that you're going to treat. Now, for example, the HexBio, this is a very elegant study. For example, you have to bear with me down. So on the top, Lactobacillus species, the treatment, the baseline 6.4, and after 12 weeks 1.2, and then it is significant. Similarly at the bottom, treatment 3.4 and remain 1.54 is significant. What it means that when we give this patient HexBio, after 12 weeks we measure, we take the stool sample, we measure the fecal load of Lactobacillus, meaning that Lactobacillus successfully passed the GI tract with full of viability. So they are not denatured by acidic in the stomach, by acidic environment in the small bowel, if you get, for example, Crohn's disease. So it proving that these are the viability of the GI tract. So that's a very important aspect you need to know when you're using the probiotics. And of course, the sugar level, for example, in HexBio, they are sweetener less than 5%. And there are many other aspects that you don't even know what ingredient is inside there, whether they got allergies to nuts or some other aspect of lactose intolerant. These are very important considerations before you treat or you give probiotics to the patient. And more importantly, HexBio contains LAB or lactic acid bacteria that secrete some enzyme called lactase. This is very important in terms of digestion breakdown of some other form of sugar, which is lactose.